Hello, it's Dr. Bowers, and I'm trying something a little different format from my usual slice, dice, put together in a PowerPoint type of video. So a little bit more informal, but let's see how it goes. So today I am going to be talking about motion and somatic dysfunction in the cervical spine. In osteopathic medical school, there is an emphasis, if not a hyper focus, for the cervical spine on the facet joints. So an osteopathic medical student is familiar with bum, bull, bum, talking about the orientation of the facets and then how that dictates what your somatic dysfunction possibilities or common possibilities are. Beyond your common possibilities is a whole world of somatic dysfunctions. And I will say that in the neck itself, actually pretty common, but not discussed so much, is the uncovertebral joints and how they get somatic dysfunction. So remember, those uncovertebral joints are those little kind of like cups on the top of the vertebral bodies and the cervical spine that the vertebra above is kind of nestled in, right? Your cervical spine doesn't have a rib cage, it doesn't have a pelvis that helps hold it in, so it has those little uncovertebral joints to help stabilize them. So you have it on the left, you have it on the right. So what is their motion? Well, they kind of slide and glide around, but in general, the motion that occurs at them is a side bending and a rotation in opposite directions, which is not what you're being told as far as somatic dysfunction possibilities in the cervical spine when you're focusing on those facet joints, where it gets drummed into you that the somatic dysfunction in the cervical spine is going to be rotated and side bent in the same direction. That is, well, other than your OA and your AA. But that is not what is going on at the facets, not what is going on at the uncovertebral joints. So let's think about this as far as ways that the neck moves, right? I can side bend and rotate my head the same way, but I also can side bend and rotate my neck opposite, right? Your sternocleidomastoid muscle, your SCMs, that is the motion effect that they have on the cervical spine. So why would you have these giant big muscles for the cervical spine to not have any mobility in their joints to actually be able to accomplish that task? Because if you didn't have that, in essence, every single time that you rotated and side bended in the opposite direction, aka the firing of the SCM or other muscles involved, you would be doing this unnatural wear and tear on your joints. So yes, built into the neck, there is the possibility of normal physiologic motion for side bending and rotating opposite in the neck, and that's those uncovertebral joints. They, when they get stuck, tend to just be a single segmental dysfunction. They're not going to get stuck as a group in my experience. Now when they're sliding and gliding, they're usually sliding and gliding as a group to help you side bend and rotate in opposite direction. But when they get stuck, it's kind of almost like one got a little bit too moved and then it just kind of got wedged into place. All right, so you can actually feel this motion yourself, palpating, doing some passive range of motion on the neck. You don't have to trust me. So basically, if you can find someone who is willing to allow you to utilize the cervical spine, what you can do is flex their neck up. Now, when else do you tend to do this in OMM lab? When you are trying to isolate the AA and OA rotation, right? But particularly the AA rotation. Why? Because you lock out those facet joints, right? You're opening them up, and so then with the motion, you are not involving them as much. So that's the whole thing here, right? I've flexed it up. I have taken out the facet joints as being the dominant driver of the motion of what the neck is going to do. So now that I've done that, when you're holding the person's head, make sure your fingertips are going to be nicely back here along that pillars, cervical pillars. And what you're going to want to do is just side bend the neck one direction and notice which side, fingers on the left or fingers on the right, do you feel those pillars bump into, aka move more posteriorly, aka rotate to. What you should notice is when you side bend that neck to the right, you are going to feel the pillars on the left turn into your fingers. And when you side bend the neck to the left, instead, you're going to feel the pillars, that column, push into the fingers on your right. So there's that rotating, side bending in opposite directions, and that's what's happening at that uncovertebral area. As far as your flexion, extension, neutral, how do they tend to get stuck? Most often I find them flexed. Second place is going to be extended, and I haven't found a neutral of them yet, which doesn't mean that they can't do that. The body is an amazing thing, and when contorted and twisted and the right or wrong force applied into it, it can do all sorts of stuff. But in general, your uncovertebral joint dysfunctions are going to be a single segment. They're going to be flexed or maybe extended, and they're going to be rotated and side bent in opposite directions. And they are definitely a big source of pain. You need that kind of wobble motion in all of those vertebrae when you're moving around and doing various activities in order for you not to have the other joints around that area to have to move more than is intended or in a way that is how they're not supposed to go, right? So if you don't have that moving at that segment, then when the neck is trying to move in a side bending one way, rotating opposite way, it's now having to try to use a facet joint as well as hopefully the on the opposite side uncovertebral joint that hopefully still is loose. Every once in a while you get both sides get dysfunction, but hopefully you still have some motion. So these guys tend to really do a crick in the neck kind of a thing. So how do I get a sense that's happening when I am palpating besides, just flexing it up and rotating, side bending, to get that general motion? What I am doing when I'm assessing for this is when the person is lying supine, essentially, probably in OMM lab, they also told you to do translation to try to get a sense of which way the segment may have a side bending preference for. I'm not going to go into that, but that's kind of the motion that you're going to want to do to try to get a sense if this is stuck. But what you're paying attention to is if you're doing that translation more towards the posterior aspects and there's a little bit of wiggle, but what happens when you come a little bit more anterior and do that? Do you have less wiggle? If you have less wiggle towards the anterior when you're trying to translate, it's likely an uncovertebral issue. If instead you can have some wiggle when you're a little bit more anterior, but not so much when you're posterior, then you're probably doing with a facet cement dysfunction. So hopefully adding that knowledge to your toolbox will help you as you're trying to figure out what is going on with your patient's neck and get it restored back to more optimal functioning order.